Stroke is the fifth leading cause of death in the U.S., but the good news is it can be prevented and treated. Now, here to discuss is neurologist up in Phoenix, Dr. Bart Demaerschalk. Good morning, doctor. Nice to have you here.
Good morning. Pleasure to be here.
So let's talk first about what a stroke is, because I'm sure a lot of people have heard about it, heard of it, but how would you define it medically?
It's a vascular disorder of the brain. Two main types, ischemic and hemorrhagic. Ischemic stroke is the most common, perhaps 80% of all stroke, and that's due to a blocked artery of the brain that deprives part of the brain of its usual blood supply, oxygen, and nutrients, causing that part of the brain to die and resulting in dysfunction. The less common but more dangerous type of stroke is hemorrhagic stroke. This is bleeding, hemorrhage in the brain. And that can be due to a variety of causes, like an aneurysm that ruptures, or high blood pressure that leads to bleeding from a ruptured or burst artery into the brain tissue.
Now, talking about some of the statistics, what are the risk factors for stroke? Which groups are more at risk, and et cetera?
There are many risk factors for stroke. Many of them are risk factors that overlap with cardiovascular disease or risk for heart attacks. Age. Some are non-modifiable, like age, gender, genetic risk factors, but many, fortunately, are modifiable. High blood pressure, high cholesterol, diabetes, cigarette smoking, sedentary lifestyle, inactivity, poor diet, heart disease. These are all risk factors that have an opportunity to be detected and modified and treated with a view of preventing or reducing the risk of a disabling stroke.
Right, and if someone is looking out for signs of a stroke, if they feel like maybe they had one or a loved one might have had one, what are the symptoms they should be looking out for?
That's a really critical question. And in the majority of instances, it's not the patient or person themselves that is capable of recognizing those signs or raising an alarm. So I'm glad that you mentioned the witnesses, the family members, the friends, because they play a critical role. And they're looking for the abrupt onset, the abrupt and unanticipated onset of 5 major signs. Paralysis on one side of the body, heaviness, weakness, paralysis on one side, arm, leg, face. Numbness on one side of the body, loss of sensation, tingling in the face, arm, and leg. Difficulty with speech and language, lack of comprehension, problems with fluency, difficulty articulating, or slurred speech. Visual problems, so the abrupt onset of loss of vision, loss of half of your vision, or double vision. And finally, the abrupt onset of a sudden and severe headache. These are the 5 warning signs, and any one of those, by themselves or in combination, should result in a medical emergency, dialing 911. That's the response.
Well, and the fact is there is so much to know. You know, we have the FAST acronym, different types of treatments specifically for ischemic strokes. Now, if somebody wants to learn more information, what's one website where they can sort of go and get all the resources they need?
I would recommend the Mayo Clinic website, American Stroke Association website, and the National Stroke Association website. Those are 3 outstanding resources for anyone to learn more about stroke and its prevention and treatment.
Dr. Bart Demaerschalk, thanks so much for your time today.
You're very welcome.